Hi, this is Kelly from North Shore Eye Care again. Now I'm sitting with Dr. Sam Baharestani. Dr. Baharestani, could you tell us a little bit about what you do and how your role here is different from a regular ophthalmologist?
Sure. So here at North Shore Eye Care, I'm an ophthalmic plastic surgeon. That's kind of a specialized field within ophthalmology that brings together two dynamic fields of medicine. I'm both an ophthalmologist, board certified in ophthalmology, and I have extra training in plastic surgery around the eyelids. What that means is that when we do our surgeries and when we do our procedures, we combine the microsurgery of ophthalmology with the cosmetic principles of plastic surgery to bring together a great aesthetic result for our patients.
Yeah, so a lot of different topics we're going to be able to cover in future videos. Today I think we had said we would talk about blepharoplasty a little bit. So just tell us, because I don't know much about that procedure, tell us a little bit about who would have that procedure, maybe some reasons why. I mean, I know a lot of celebrities are doing it now, but their reasons are more cosmetic.
Sure. So droopy eyelids is one of the most common things that patients present to us with in the office here, and it's one of the most common things that I take care of. Blepharoplasty is a procedure where we remove extra skin and fatty tissue from the upper and lower eyelids to help achieve a rejuvenated look to the way the eyes look. So the most common reason why people come for blepharoplasty is because they have extra skin that's hanging down onto their lashes and obstructing their peripheral vision. A lot of people, their insurance will actually cover to have the extra skin and fatty tissue trimmed away. In the office, we do some testing to see how much the extra skin is affecting the vision to be able to tell whether the procedure can be covered by insurance or not. For most people, if the skin is drooping down so much and obstructing the vision, the insurance will cover to have their upper eyelids lifted. Lower eyelids are kind of a different story, where most insurance companies would consider that to be cosmetic.
Right.
The insurance companies don't really care about what we look like, they just want to make sure that we can see.
Right.
So as long as we can show that some of the extra skin is blocking the peripheral vision, they would be happy to cover it and have that done.
And if not, I know here at North Shore Eye Care we offer financing, so is that something that's an option for people who want to do it just for cosmetic?
Absolutely. There are plenty of people that come to us in the office that have the extra skin, but it doesn't define the criteria that would be covered by insurance. Or people just want a cosmetic result from their surgery, so there are different options to pay for it. It's an affordable surgery for everybody, and we do offer care credit that offers financing options for all of our patients, so it becomes an affordable thing for anybody who walks through our doors.
That's great. How old would you say most patients, the age range?
So it kind of depends on what the particular patient is hoping to achieve. You know, we get all sorts of patients who are in the Medicare population, meaning 65 or older, who are just looking for an improvement in their vision. There are also plenty of people who are younger that are just looking to trim away extra skin because they don't like the way their eyelids look, or there have been some aging changes or sun damage that have caused a change. So we get patients anywhere ranging from 40s to 80s presenting for blepharoplasty.
Okay, very interesting. So I think then one thing we should do in the future is maybe take a look at the procedure and how it's done, and maybe talk to some of your patients who have gone through the process.
Absolutely.
Okay.
We've had many happy results here at North Shore Eye Care, and I'd love to invite you to the operating room to see how we do it.
That would be wonderful. I'd love to. I also was thinking, how long is the recovery for something like this? We really didn't touch on that, and I'm sure a lot of people are concerned with that as well.
Sure. Good question. So the procedure itself for upper eyelids usually takes about 30 minutes to do, and is done in an ambulatory surgery center under IV sedation, meaning most patients are sleepy throughout the procedure. After that, the patients usually go home normal to have some stitches in the eyelids that usually stay in for a week. I usually see my patients a week after surgery to make sure everything's healing okay, and we remove the stitches in the office. Most people get black and blue, a little bit sore and swollen from this type of procedure. That usually lasts for a week or 10 days or so. I usually advise my patients to use ice on their eyelids to help keep the swelling and bruising down, and usually by a week or 10 days, most of that is gone.
Okay, so it's nothing significant after that point.
No, everybody's a little bit different, but a week to 10 days is the general thing that we advise.
Okay, I'm definitely going to take you up on it and come check you out in the OR. I'd love to see some of the procedures and meet some of your patients.
Awesome, love to
So
have
we'll
you
talk about it again very soon. So if you would like to make an appointment and meet Dr. Baharestani in our office, have a consultation, you can call 631-265-8780 or also check out our website, www.nseye.com. His surgical coordinator, Jennifer Keenley, would be happy to help you with that.